It's 2:05, so I'm going to go ahead and get started, and of course anybody can trickle in as the afternoon progresses. My name is Mary Duffy. I'm with the Danny Did Foundation. I'm from Chicago, and that's where our foundation was established in the name of Danny Stanton, which I'll get to in a minute. It's very exciting to be here. This is our actually 11th time that we've been to this wonderful event at Disneyland, and probably the only time I've ever given a presentation in a fairy godmother costume, so it's kind of fun. I think something Danny would really enjoy as well. So to overview today, I'll go ahead and start with the story of Danny and the fact that he is no longer with us, and the cause of that was sudden unexpected death in epilepsy, or you might hear the word SUDEP. And then we'll go ahead and talk a little bit on technology in the epilepsy space and its utility for patients and caregivers. I'll start with Danny's story. And can everyone hear me okay? Yeah, thank you. So first, that's Danny. I'd like to introduce you to him. He was an athletic and affectionate, smart kid who enjoyed doing lots of fun things, especially with his siblings pictured here, Mary Grace, John, and Tommy. And he was my son's best friend, so that's why I work for the organization. I'm extremely close with his parents, and we're neighbors in the Chicago area as well. He was an amazing little friend, the first friend that my son had, so he taught us a little bit about friendship, and we'll always be grateful for that. Danny had his first seizure when he was 2 years old. And his parents witnessed just about a handful of those seizures, maybe 4 or 5. But in hindsight now, wonder often had they missed more, especially because they were nocturnal seizures. And he had no other medical complications. Just a few months before Danny's 5th birthday, his parents took him to a routine doctor appointment with his neurologist, and it was actually on a Tuesday, and they did change his medication a little bit because of some weight growth. He was growing at that time and had some weight gain, and we're told that he was on a good path. And 4 days later, on a Saturday morning, Danny was found in his bottom of his bunk bed, shared with his brother. Unfortunately, he had passed. And his parents learned about that word SUDEP days later when they received the death certificate. And they had never heard of it before. And that's why we started the foundation. Danny's parents wanted to fill that communication gap and some other treatment gaps that they experienced with Danny in his honor. And the name of our organization comes from the obituary that Danny's father wrote, "Please go and enjoy your life, Danny did." And so despite the tragic origins of the foundation, it's the spirit and joy of Danny that moves us and motivates us to keep working and to help other families. Let's see here. And he has a new place now in that we share with the world. And the main areas of focus for our foundation are twofold. One is public awareness around epilepsy, and then, of course, in particular, about the risk of SUDEP. And we advocate for honest, open dialogue between doctors and patients, and doctors and their caregivers and parents. As everyone in this room knows, parents can and do digest difficult conversations and difficult information quite often and talk about risks with their loved ones who are facing epilepsy. And at the end of the day, as parents, it's our job to be a caregiver and to consume this type of information and then to shape it into the best possible treatment plan. Our second area of focus is to increase awareness and access to devices and technologies that can alert to seizures. And to give you a visual representation of this cause, or of our cause, I'm going to play a short video. And I hope the sound works. Let's see. That is not the video. Let's see. It doesn't seem to want to pull the video. Let me try one more. Oh, it's that one. I can see her, and then she disappeared. Do you see her? Yeah. Okay, we're going to skip it. So let's move on and talk about The risks. So risks for people with epilepsy. And again, many of you in this room are well aware of these risks and have talked about them with your family and your doctors. The seizures can cause accidents, including injuries or head trauma. People with epilepsy need to be cautious and supervised with swimming or if they're bathing. There are risks tied to driving. There is a risk of status epilepticus. There is a risk for sudden unexpected death in epilepsy. And unfortunately, there can be an increased risk for depression or suicide. So what is SUDEP? Before little Danny died, his parents had never heard of that word, as I mentioned. It was never a risk that was raised to them by their neurologist, and many in the general public, as well as many in the epilepsy community, learned of the word of SUDEP when, unfortunately, the passing of Cameron Boyce, the Disney star. And his parents also had never heard of SUDEP. And I had families contact me, a lot of families contacted me after that, that tragic story of Cameron, and felt, well, if Cameron Boyce's parents weren't receiving the best possible care, how do we feel about it in a small town, that we're going to get the care that we deserve and need? And their points were valid. So the SUDEP definition is there. I'll read it. A death is referred to as a SUDEP when a seemingly healthy person with epilepsy dies unexpectedly, and there's no clear reason for the death that can be determined. In most cases, an autopsy is required to rule out other causes of death, and the most common criteria used to determine whether a death is SUDEP is that the person has epilepsy, they died unexpectedly while in a reasonably good state of health. The death occurred suddenly and during normal activity, and that's often during sleep. That there's not an obvious cause of death that would be ruled out in an autopsy, and the death was not a result of status epilepticus or prolonged seizure clusters. So why and how often? In most cases of SUDEP, the incident is not witnessed, and the patient is found dead in the morning by their parents, which was the case with Danny. The precise reasons regarding what causes a case of SUDEP are still being researched. That's one of the most frustrating aspects of SUDEP, that we just don't know yet why it happens. But there are some main theories regarding perhaps cerebral shutdown, when the brain shuts off and breathing might be suppressed. That lack of respiration may be the primary cause. In fact, there was a recent published paper in the Journal of Clinical Investigation, and that was from the University of Iowa lab that explored that respiration theory. There's also could be cardiac abnormalities. A seizure may be a dangerous heart rhythm or even heart failure. It's also possible that SUDEP may be a result of more than one cause or different in different cases. And how often? A lot of people like to know some statistics. Most research suggests that SUDEP occurs in 1 in 1,000 people with epilepsy, and that applies to both adults and to children. And for for people who have refractory or uncontrolled seizures, the rate increases to 1 in 150. So seizure control really is critical. And there are some risk factors that we can talk about. Uncontrolled seizures, regular tonic-clonic seizures at night present the greatest risk for SUDEP. People who are either or in both of those categories, which is a high volume of seizures, convulsive seizures, are at the highest risk. And again, that's where Danny fell into that latter category. Other risks that are definitely being looked at are epilepsy at an early age and early diagnosis, having epilepsy for a long period of time, a long duration, not taking medication as prescribed, drinking alcohol or other lifestyle choices that instigate seizure activity. And disclosure, it can be very powerful and make quite a difference in SUDEP. At Danny Did, we do disclose, we're doing it right now, this risk of SUDEP to caregivers, but we always maintain that information is best delivered not by us or not doctors, but by your healthcare provider, your treatment team. It builds trust, and it can also lead to a better treatment plan. In 2017, the American Academic of Neurology and the American Epilepsy Society passed their first ever practice guideline on SUDEP. What that essentially said is that patients should be counseled about the risk. The significance of this report was that, or guidelines I should say, was that before many providers only discuss SUDEP for what they consider their high-risk patients. So now the guidelines ask that that is discussed with all patients. And we encourage you as caregivers, people living with epilepsy or parents here, you can be part of this change too, initiate this conversation about SUDEP. And then this topic, again, is so important to Danny Did that we joined in, quite a few advocacy organizations in distributing a Duke University survey to caregivers in the epilepsy community to learn how parents preferred to learn about the risk of SUDEP. The overarching takeaway was that caregivers want to receive information about SUDEP from their healthcare provider, but they typically hear about it elsewhere. On the slide, you can see that disparity between caregivers' desire versus the current state of care, the current standard of care. In open-ended responses from this study, which was published this year in the Annals of the Child Neurology Society, caregivers highlighted the value of learning about SUDEP from their healthcare provider, the importance of pairing SUDEP disclosure with the discussion about how to reduce those risks, and the need for educational resources and peer support, which again is where Danny Did would like to come in, and for doctors to be able to refer them to Danny Did to continue any type of conversations about the subject. These findings highlight the urgent need for interventions to improve and to support SUDEP risk communication. There's no 100% tactic to prevent SUDEP, but we do believe there are steps that you can use to promote patient and families to minimizing those risks. And it all starts, again, with communication between the provider and the family. And there's other ways that you can help reduce risk by maximizing seizure control via your medical treatment adherence, regular physical activity and lifestyle habits that reduce stress and seizure activity, regular doctor visits, ideally with a specialist, which is called an epileptologist. Ensure that family members and caregivers have knowledge of your seizure first aid or your seizure action plan. Advocates, you yourself advocating for research into a better understanding of the causes of SUDEP. There's also a new website that was launched this February. It's called the preventingepilepsy.org. Yes, .org. And that encourages, it brings both parties to the table, meaning it is a toolkit for caregivers and clinicians. And their tagline is that you're going to assess your risk, act, and empower yourselves to have these conversations. So both parties are involved. And there are quite a few toolkits on there. There's a handout for patients to bring to the doctor appointment to mention, here's some things I want to talk about, and have that written down before you walk into the office. There's also tools for the clinician. There's behavioral models. There's videos that they can use and outlines. And we also consider the use of alternative resources such as monitoring devices that detect certain seizures and can alert caregivers to enable early intervention. That last piece there is the main focus of one of our key programs at the Danny Did Foundation. So let's talk about how devices can be resourceful and both to patients but also to clinicians. And first we'll talk about caregivers and patients. Technology within epilepsy is fast growing, and we consider devices and technology as a complement to medication, surgery, diet as part of your patient's treatment plan. I'll explain more about the specifics of seizure alerting devices in a minute, but let's first discuss why we feel patients and clinicians can benefit from them. We do view these devices as another tool in your tool belt, if you will. A device can't replace a parent's instincts or their vigilance, but monitoring and alerting a system can be a piece of the puzzle to lending backup and notifying you if a seizure takes place. You know, we often hear families tell us that when we're in the hospital, our child was monitored. There were different monitoring devices used on them, and of course well-being checks by nurses and whatnot. But then when you leave the hospital, it's just you again. And we do feel strongly that monitoring is just as important at home. And again, of early intervention, if you can be present and you can act, and you'll have a chance. On the slide here, some benefits to using the devices. It improves seizure tracking for persons with epilepsy, especially if you have any type of memory issues that come with your epilepsy or your medications. Improved tracking for the caregiver who is responsible for the patient. Added safety for the person with epilepsy, knowing that someone's going to come to their aid. And that leads to reduced anxiety. And wearing a device can increase independence for patients, allowing perhaps that child to go to a friend's home or a sleepover or the movie theater, things that they might not have done in the past. And then increased peace of mind for you, the caregiver, that you will be alerted for your loved one. No one wants to or should be alone during a seizure. And then providers can benefit from the use of monitoring devices and alerting devices in the home. In addition to testing, the management and treatment of epilepsy is often guided by what you tell them, your assessment of your seizure reoccurrences and the frequency of them. But that self-reporting and patient recall is not always reliable. So clinicians like the devices because they engage patients in their own care, sharing data, having healthy conversations. They like that devices prompt timely interventions that could reduce risks. They like that they can promote more accurate data on the frequency of the seizures and less reliance on that patient recall. And often in long-term use, they could possibly be used for research and maybe identify some biomarkers of SUDEP. And we could talk next on how to select a device for your specific needs. And some things to consider is, there's a lot going on. There's luckily a good pipeline of devices, and we hope we can be a resource for that. But our role is not to recommend or endorse one specific product, but simply to let parents know what is out there and what their options are. And before picking a specific device, it's important to go through a checklist of practical, common sense consideration. When considering an alerting device, the obvious first step is whether the device detects the type of seizure that you or your child has. Different seizures can be detected through different methods and through different devices. We encourage patients and caregivers to talk with their doctor about how their seizure presents and which type of device would be the best for detecting that type of seizure. You're going to want to look at the goals for the device. Are you looking to notify somebody when there is a seizure? And or do you just want to track seizures, or do you want to do both? And then you want to consider the comfort and the reliance of the device. No device will be effective if it's not used correctly. So just making sure that you consider comfort of the device, if it's a wearable, if your child will tolerate it. Some families have privacy conversations, so just keeping things in mind. And then, of course, the ease of the setup of the device and maintaining the device, too. It's important to understand what's required for the device. For example, some technologies, you do need internet access, Bluetooth, perhaps there's a camera involved, or smart devices like an iPad might need to complement the device as well for the alerting portion and for the data collection. And then determining the cost. Monitoring devices can have multiple costs. Questions considering what's the actual cost of the device. Is there a monthly or an annual fee, a subscription fee? Are there any maintenance costs to the device? Do you need another device? Meaning, does the device talk through a watch or an iPad or other type of technology that you would need to have in the home? And then is it covered by insurance? And unfortunately, we found the answer is no. That's why we exist. That's why we're here. That's why we developed this program. And until they are covered by insurance, which we are part of working on that as well, again, we'll fill that gap for you. And I'll get to how to do that shortly. So the types, the different devices. Now, people often hear about VNS and RNS, which is technology, but that's implanted technology, a surgical option, but something that you could definitely talk about with your doctor. But here today we're going to talk about non-invasive solutions. Okay, so it's likely that everyone here in the room knows the vulnerability of seizures during sleep. So there are mattress sensors and video-based monitoring for nocturnal use. For people facing epilepsy, nighttime can be very scary, and an alerting device can provide a layer of support for families that need that. For individuals who have seizures at any time of the day, a wearable option might be best. There are wristwatches, wrist sensors, and then also watches that you download apps to protect your loved one and to pick up movements and other biomarkers. These devices allow an individual to maintain some independence, go to work, go to school, play outside, and have that comfort knowing that their device will alert someone if they need them. Early intervention is so important during a seizure. Depending on each individual, intervention may look different, but no one should seize alone. So when someone's alerted to a seizure, they can take those steps. Maybe it involves rescue medications, or just, again, whatever your first aid response is and your action plan is, that's when it would kick off after this alert. We're going to talk about some devices here specifically. It should be on my next screen. Okay, so nocturnal. So there are some devices on the market now that you can research. One is called the MFIT Movement Monitor, and the other is the SAMI, the Sleep Activity Monitor, which works with Apple products right now. And there's a third, there's a company here called Eureka Sleep, which looks at heart rate, blood oxygen, and movement for ages 5 and older, and that's a ring that's worn on the child's finger or the adult's finger while they're sleeping. And then also, a lot of them have other important, that I won't get into right now, but important items such as maybe medication reminders, a log to keep your seizure notes, so other data that you can collect and keep it all in one place. And then the wearable monitors would be the ones that would be more for 24 hours, or especially for families who have independent children who are leaving the house. And you can look at these here. They're mainly watches. The Embrace by Empatica is a wristband that is their hardware that's sent to you, and then you have subscription-based monthly fee or annual fee to be alerted to devices. The Inspire app is a little bit different in that it is an app that you would download onto your watch. You don't have to have a phone paired with it. Meaning, often families say to me, I can do the watch and leave the child with the watch, but they can't be responsible for a $400 phone on top of that. They might leave it at the playground, and it's just too risky given the expense. So Inspire app just announced that the watch can now talk directly to mom's phone or caregiver's phone without the child having to carry a phone as well. And then pulse oximeter. So many families approach us and let us know that they do see changes in levels, and would be like to be notified of that too. That is a prescription-based product only though, so you would have to see your doctor about that. And again, it attaches to the fingertip. Most people are probably familiar from hospital stays, or the toe, and it looks at heart rate and blood oxygen percentage, both vital statistics that can be affected during a person's seizures. So especially if families are having absence seizures or seizures that don't have a lot of movement, this is their detector. It's Massimo is the company that makes this RAD 97 that's up here right now that is most portable. And then limitations of devices. We don't act that these devices are perfect, and no company would ever claim that they are the answer to SUDEP. But again, another tool to alert you so you can give seizure response. Some current challenges is that families have asked us for multi devices that can alert to different types of seizures, not just one type, maybe not just movement or not just absence, but combining them so they're not using 2 or 3 things at once. So there's a need for further development products in the device market. However, the process to get a device developed and covered by insurance is not a smooth path. And devices are kind of in the early stages if you consider the history of this technology. The FDA requires high quality validation studies, and clinical studies are necessary to move medicine, to move treatment, to move therapies, and to move devices forward. This can be a long and expensive process, but one that's essential and will help develop future devices. So one day you might be asked to participate in a trial for a product like this, and we do encourage you to participate. Studies and efficacies of devices help to reduce false alarms and lead to product improvements overall. And most doctors are not comfortable with referring patients if a device is not FDA approved. So it's kind of the circle that we need to change and break. Limitations, I did mention that devices are used in a hospital setting don't always work the same in the home, and that's what families are searching for. That same sense of safety that they feel when they're in the hospital. Again, product weaknesses that need to be addressed is use of one device that can detect many different types of seizures. Rates of false alarm, of course, have to be reduced, or families will become frustrated and turn them off. And then battery length and Bluetooth strength, so that you can be anywhere and feel comfortable and safe. And what's coming next is at the Danny Did Foundation, we do our best to keep involved with pipeline, and we hear what families are looking for and doctors are looking for, and it seems to be a focus on respiration and oxygen saturation to determine a seizure. And new apps and software are being developed. There is, for example, there's a app diary that's using algorithms to forecast the likelihood of your next seizure. It's kind of in the early stages, but it is quite interesting. Apps and portals that share data between doctor and patient between visits. Seizure apps that share information with doctors help during titration periods. They help to recognize side effects, report an increase or decrease in seizure activity, and determine if a change in treatment plan is necessary. And that would happen between appointments, because it would just be talking to your doctor through the app. And the pipeline is something we're always interested in. As I mentioned, devices are being designed to predict a seizure before it happens. There's a company working on a product type of headband that would be home EEG they are working on that it would alert you before the seizure begins based on the readings. There's also an innovator that I've met in Zabia, and he's working on an earpiece EEG through EEG, the same thing, so that it would any type of seizure. So you would not have to have movement, and it would be alarming. So we do have conversations all over the world, and we're excited about the possibilities and the interest in the field. Danny Did is part of Epilepsy Foundation's contest that is called Shark Tank each year, and it's similar to the show you're probably aware of on TV, where innovators come and present their product. And they win a cash prize, and it helps to move them to the next stage of their development. And we're also part of the Epilepsy Foundation Accelerator course, and we attend roundtable conferences, again, to further medical device development. It will be held next spring with an emphasis on coverage, so that the insurance companies pick this up as well. The ultimate device, of course, would be a non-invasive system that predicts seizures and delivers an intervention to suppress it. And we hope that is next. Okay, so let's see here. So let me pause and talk about Danny Did real quick, the seizure detection device program. We established this, when Marianne, when Danny passed away, Marianne said, you need to give families a chance I didn't know about SUDEP, so I didn't know what I was up against. And had I known, maybe I would have found one of these devices. And the what ifs, as you imagine, and maybe there's people who've lost in this audience, the what ifs are tough. So we developed this program to bridge that gap. So if someone says, great, there's this device, but I can't afford it, now we can say, let us help you get that into your home. So if there's any type of finance barrier for patients, we do ask that you reach out to us. This is just one of the brochures that's off our table. We have a table in the expo right now, but you could just simply go to the website, click on the devices program, research the devices. There's also a webinar for each device, meaning we invited the manufacturers to present. It's called Dissecting Devices, and so it's their own words, better than mine, explaining their product and how it works and which one might be a good fit for you. So you can watch the webinars, fill out the application, and then it's just a short phone conversation that we would have, and a little interview before we decide if you'd be reimbursed. And I say reimbursed because, again, the relationship is between you and the manufacturer, you and the company. You buy the device, you have the customer service and the receipt and the warranty under your name at that point. So again, stop by our booth. We have plenty of brochures and business cards if you want to visit. And another thing that's important is that we're part of what's called the Pay Me Collaborative. And it's been over a decade for that as well. And PAMI's mission is to convene, educate, and inspire all stakeholders, from the bereaved families to those living with epilepsy, to healthcare providers, advocates, clinical and basic scientists, and death investigators, to promote the understanding and to drive prevention of epilepsy-related mortality. So it used to be every other year. There's such a need that each year now it sells out. It's in Orlando next month. And again, all of those partners come to the same table for an entire day of discussion on this very important topic. We also offer a bereaved session the night before, or the afternoon before, so families from all across, actually the world now, attend this session and just feel that sense of community, and of course learn what's going on in the world of SUDEP and mortality, so that they understand that there are very talented people studying this and looking to move it forward. PAMI also offers webinars throughout the year, and they have a website which is just PAMI.org if anybody's interested. Okay, and I think I'm nearing the end. Let's see what this is. Okay, get involved. Of course, everybody's always invited to join us and on our mission. We have, what do we have here? Yes, we have Team Danny Did. So those are people who might want to bike, ride, swim, do different endurance challenges, and then have their family and community support them. And then, of course, the funds come to us so that we can further our mission, help other families with epilepsy-related, seizure monitors, and promote awareness of SUDEP. We have family ambassadors from all around the country as well. The woman who's working our table right now has a daughter with epilepsy, and she's our volunteer from the state of California. So it's a fun way to get involved and bring our mission to your community and be part of the change. And lastly, we're here to help. And I think my last slide will have our info at dannydid.org. So again, we want to engage anyone who's interested in our mission, who shares our feelings of hope, and to provide safety for those living with epilepsy. And we're available for any follow-up questions now, or if you'd like to talk at the table, please do feel free to stop by. So I believe we have time for question and answers. Let me look here. Yeah, we do. If anybody has anything, hi, go ahead.
Hey, on the scholarship for the monitors, is it both the upfront cost of the monitor and the subscription?
Oh yeah, that's a great question. So she's asking if a device comes as a subscription model, meaning you have to pay every month, how would that work in terms of the grant? So we do provide the hardware and 1 year of service. And then at that time, you can reevaluate, did it work? Was it helpful to your family? And if yes, then we can consider you for a second grant the next year, but it would be just the subscription cost. Yeah. Thank you. Any other questions? Go ahead.
I'm just wondering for SUDEP, is that something that's more likely to happen once they're weaning off medication?
I don't think I've ever read anything about that, except that when you are weaning, you are watched pretty darn carefully by both your doctors and parents and caregivers. But anytime, no, I haven't heard of anything that SUDEP occurred. Now, Danny's case was a little bit different. He was actually, they were increasing his meds. So there was a change in meds. So it's noted that was happening when he passed. But with the weaning or breakthrough seizures, I think it's still all part of your whole treatment plan and a good conversation to have with your doctor.
My doctor brought up that co-sleeping can be a huge benefit for preventing SUDEP. But after hearing just more about it, I'm curious, if it's potentially like a respiratory depression or a heart issue, just being there, how can that help? Rescue meds, but you can't really wake somebody up after seizure.
Yeah.
Is it just there providing supports that breathe better? Or?
So he's probably saying that just for intervention, just like a device can. There's no better prevention or intervention than a loved one and a caregiver. So we always tell people to do what works for their family. Sometimes a child gets too old for that, or is not comfortable with that, or if it's a spouse, there's different reasons that yes or no, that they might look towards a device. And your question, the second part of your question was, oh, because it's respiratory, what would you do? So in other words, if you're there and you notice that there was a seizure, maybe you would be woken up, you could do CPR, call 911 quicker, just things like that, that if they were in a room by themselves, hours might have passed before you were able to check on them. Go ahead.
My nephew just recently had a baby, and I went to go visit my nephew, and the baby had a little sock on, special sock for sudden
SIDS.
SIDS.
Mm-hmm.
Is there such a thing? Have you heard of such a thing for epilepsy? Because this
Yeah.
sock supposedly detects the breathing pattern,
Yeah.
sleep, whether the baby turned. I was surprised I hadn't
Yeah.
seen anything like that.
Yeah, there is some devices out there for SIDS. That's called the owlet sock. You transition out of owlet because the skin is thin, and that's why it works so well in infants. As it develops, it won't read through the skin anymore. He should probably check the owlet a little bit more carefully and look at their website as well. There's been some issues with it as well. But that is basically the same idea. You know, there's a lot of studies trying to figure out SIDS, SUDEP, SUDC, which is sudden death child, and what are the best monitors for all of these. So there were families, and that epilepsy families that were using the owlet. There was another company called MICU that unfortunately I think they're coming on hard times as well, which was not a wearable, but it was a baby monitor. Epilepsy moms found it, and it was monitoring the same things that we want to monitor, so they started using it as well. But they're having business problems right now. But it was a great device, and it will be replicated. I mean, we just have to keep our eyes and ears open for things like that. To do exactly what they're doing, looking, feeling more comfortable at night, looking at respiration and oxygen.
What would you recommend is the best way to keep up with the new devices and apps and everything else that's coming out?
Yeah, I know. I know, because even this is our job, and sometimes people come here and educate me on new devices and things like that. So I think it's really just doing those keyword searches with monitoring. Asking your doctor, making him start getting involved in technology too, and saying, what have you heard? You've been to quite a few conferences this year, and these subjects are discussed at their epilepsy and epileptologist meetings. So I think a lot of keyword searches. We're going to keep on it too on our website. There is quite a few conferences. Matt, you might be able to help me with these, but there's, for instance, now the new one is the AI Medical Device Conference. And my colleague attended that last spring, and that was extremely interesting. It opens up a whole new realm of questions, though, as well. But so I think if you could just keep doing that, checking the different websites, just in the App Store, epilepsy, seizures, monitoring, things like that. And again, sometimes they've fallen upon these things, like the families that were using the MICU. Didn't say the word epilepsy, but it was the right words that they wanted to, the biomarkers that they wanted to track. And so, in fact, MICU, once they found out the epilepsy families were using it, they started a study with an epileptologist at Boston to further it, because they realized, we think we can help your community. So hopefully that will continue to happen. But these accelerator courses, that's where a lot of them come out of, in these Shark Tank, once they become winners, and then they have this prize to move to the next level, which might include marketing and whatnot. That's why we do that, because we just want to keep pushing them to the next level so that they can become a common name in the epilepsy community. Go ahead.
This machine doesn't audit, but a CPAP machine, does that help? Or are there any studies that say that because that's forced oxygen to your,
Yeah.
I don't know.
I think I'm not a doctor, so you probably would have to talk about that with your doctor and what happens to your child when he has the seizures. Is it a lack of oxygen? It might not be for everybody, but that might be something, to discuss with the doctor. and not being afraid to see different specialists too, and making sure that those doctors are coordinating their care. Like maybe you're seeing a cardiologist, or there's sleep apnea, or you have a sleep doctor, different things like that. One thing on that preventingepilepsy.mortality.org has a list of, hey doc, now I want to talk about, I've never been referred out for a specialist, I've never been referred to a dietitian, a surgeon, a geneticist, to look at a genetic panel, sleep disorders. There's a lot of research if you do sleep disorders in SUDEP that people are trying to see if there is a correlation. So it's good to challenge your doctor and say, what else? Go ahead.
Do you have any idea how we get anti-suffocation pillows here in the U.S. a lot more
Yes, I do.
accessible?
Yes, you can go to visit SAMI. Their tables here, SAMI, and they have devices. The video monitor.
No, anti-suffocation
Yeah.
pillows, right?
And they also sell pillows, anti-suffocation pillows.
So through SAMI?
SAMI, SAMI.
Is there a reason why they're really easy to get in the UK and not?
I don't know. I mean, a lot of reason why there's a lot of devices that aren't in the United States because of the FDA approval process and how expensive and timely that can be. And some of these are mom and pop stores, and it's just or manufacturers, and it's hard. But yes, they are from overseas.
You want me to speak to that a little bit?
Sure.
Hi guys, I'm Matt, I'm the CEO of Singular, and we have something that's called the Breathe Easy pillow, and it is designed exactly like the anti-suffocation pillows that you find in the UK.
Yeah.
And we brought that to market from our partner in Australia, and we market it as a breathable pillow. Now, I think the reason that anti-suffocation pillows haven't been brought into the US and marketed as such is because of the FDA issue.
Because it's a medical device.
Because it's technically a medical device. When you start saying terms like anti-suffocation, so Breathe Easy was selling in the US for a little while, but I think because it was done under anti-suffocation, they were told to stop doing that. So we're just essentially trying to make it available to families and not saying anti-suffocation because it is not
Yeah.
anti-suffocation, it's breathable. But
Let's connect.
yeah.
I think some of the foundations should make them. I walked in there in the beginning last year. I have a clinical term to him that 6 years ago. So I'm on the journey trying to make sure he stays alive. He has a brother who passed away. Came alive. And an anti-suffocation pillow would have been a game changer for my son who was laying next to my husband.
Right.
So, small things like that. The wearable thing that we were asking, there is a Eureka device that is partnering with the SUDEP Data Foundation plus a SAMI is like,
Yeah.
at least
Yeah.
for big kids like
Yeah.
others, we really also,
Yeah.
sorry.
No, that's good. I did mention those things, but it's the Eureka ring is here at their table, so it's definitely worth. And it does look at things outside of just movement. It does alert to movement, but it does look at heart rate and oxygen. So it's
And it has AI and stuff, and it's wearable, which for
Yeah.
big kids is like,
yeah nocturnal. It's called Eureka Sleep, so it is to be worn in the house.
thank you.
Thank you.
I don't know, and I was going back and forth. I don't know if you'll know the answer to this or not, but we're dealing with head drop seizures more than anything else. And like we have modern devices for nighttime, that's not our issue. The concern I have is we've been dealing with seizures for 18 years. About a month ago was the first time I ever heard the term SUDEP. And I am concerned that one of these days she's just going to have a head drop and just not pick it up. And I don't know if SUDEP is prevalent in all kinds of seizures, or if it's just sleeping, nighttime seizure activity, full breakthrough seizures, or if the head drops are in the category.
So So until they can give a perfect definition of or decide what causes SUDEP, they're not going to narrow it yet. So my answer would be yes, she's at risk because they're not ruling anyone out at this point. In other words, most cases are during sleep. Most cases are they had a history of nocturnal convulsive seizures. That's not everybody though. So, there are instances that fall outside of that definition, which is why it's so incredibly frustrating. And I mean, my heart goes out to you because you're right, I don't have an answer except that you just have to continue to be as diligent as you're being. And that probably a helmet if you're not already.
I mean, I'm going in my head, I'm going through what would you do if there's that? Is SUDEP typically, does it just affect the breathing? Does it affect their heart? Do they have a cardiac event? Do they have a TBI? Do they have what actually is the trigger?
Yeah.
What makes it, it's more research, I guess.
It's more research. It is happening. That's what PAMI's about too, that conference I was mentioning where people come and doctors and investigators come and explain their research in their labs, what they've been looking at, and present to each other and kind of incentivize each other to keep going. But that's why like I said, it was every 2 years, and now it's every year because there's so much need for it, but also because there's progress. Before we needed 2 years before there was anything to report, and that's not the case anymore. Now every year that somebody's standing up saying, I've got something. So hopefully they're getting closer and closer, and we're just going to do our part to keep bringing them to that table. Again, we're not doctors, but we can,
Sometimes you know more though.
Yeah, well, that's how I feel about all your parents. Like it is, if another mom tells you something, it's the best information you can get. Hey, have you tried this? Have you looked at this? Have you seen this website? Talk to your doctor about this prescription. It's amazing. We often talked when we first began that everybody, when I would say, how'd you find out about SUDEP? And they would say Facebook. And I had such a love-hate with Facebook, right? And then at that time I thought, well, thank God for Facebook. Because if that's the only way, a mom from Oregon told a mom from California, wait, did you just mention SUDEP in that last post? What is that? And that's how it started happening. So it's the patients speaking to the patients. And I don't want that to stop, but I want that conversation to happen with your doctor so that your treatment plan can reflect what you need it to reflect in your specific needs. Thank you. All right. Well, thank you, everybody. It was nice to meet. It was a good conversation, so thank you for coming.